Good morning, everybody. We're going to go ahead and get started. Welcome. This is Jen Brockman with the Iowa Healthcare Collaborative. I also have Nancy Wild and Cheryl Marshall on the line that will also be presenting today. Today is part 2 of our CAUTI and CLABSI community of practice. Today we're going to be talking about best practices for prevention for CAUTI and CLABSI. And again, with the community of practice, one of the ideas around community of practice is to really encourage sharing and conversation around the topic of the webinar. And so I encourage you all to
I don't know what to move stuff. Okay. I don't know.
I just didn't know if she was over there.
Just one side note, if you are if you please mute your lines. I do have all the lines open right now, so people can freely speak up and join in on the conversation. So please mute your lines. Do not place us on hold because then we'll hear your hold music. But if you could please place your line on mute until you are ready to speak up, that would be fantastic. So again, with the idea of community of practice is for people to feel like they can join in on the conversation. And if you have something to share or a question while we're discussing things, please feel free to chime in on the line or type a comment into the chat box, and we'll answer those for you. Or if you have new innovative ideas, things that you're doing within your organization, please feel free to share. I'm just going to... So talking about CAUTI and CLABSI, a lot of the things that we're doing with HEN 2.0 involve statewide collaboration. So IHC, Telogen, and IDPH are all working on HAIs. They're all a focus for each one of our organizations. So one thing that we've really tried to do during this contract, this time period, is to make sure that we are talking and we're working together. So Nancy Wild, Cheryl Marshall, and I come together on a monthly basis to talk about what we're working on, who we're working on, and what we can do to collaborate. I know there's been lots of confusion in the past, who's working on what and how are they working on it, and I know several of you may have been working with one, two, or all three of those different organizations. And so we've really tried to communicate to each other to reduce some of that, that confusion. We've also tried to bring some more content and education for these monthly IP calls, and we very much appreciate your input and your participation. So if there are topics that anybody wants to hear more about, or you have questions about, please feel free to contact Nancy or Cheryl or myself, and we can try to add some of those topics into future calls. Again, please, if you're just joining us, please make sure that you mute your line. Some of the things that drive change within our state, I'm sure you, most of you probably remember that back in 2014, we looked at policies across the state, what hospitals were currently doing, looking at strategies for policy implementation.
This is Joyce over at the hospital. And Amy Ponsolo did a kids live physical.
Again, please, I can hear people hollering.
And
try to make sure that we mute our lines. Standardization of policies across the state. So the Iowa Healthcare Collaborative in 2014 did release some recommendations for policies and procedures for CAUTI reduction as well as nurse-driven protocols. Using those resources and data to drive change, so looking at your NHSN data, we do encourage all hospitals to report to NHSN. I know for critical access hospitals that is not a requirement, but the majority of hospitals in Iowa do now report to NHSN. So we, for the HEN measures, pull directly from NHSN, and that data is included in your HEN 2.0 run chart. We do encouraging mentoring among hospitals and long-term care centers, and we have seen lots of that across the state. I know there are a couple districts that have reached out to long-term care in those areas and worked closely with them as far as education. Again, our monthly IP calls we hold, IDPH, IHC, and Telogen all provide technical assistance as needed. We do encourage, we encourage the use of the bundle in the ED setting as well as the inpatient setting to decrease catheter utilization. We've talked before about empowering and educating nurses and providers as far as the use of those bundles for CAUTI and CLABSI. Also, a large component of HEN 2.0 has been to educate and engage patients and families. So talking to them about catheter care, use of the catheter in the hospital, some of the things that they can impact while their loved one is being cared for in the hospital. Again, the use of the CAUTI nurse-driven protocol and implementation of hard stops within the EMRs. And we've seen variations of that across the state for the use of the indications for continued use or indications for insertion for CAUTI especially. Lots of this is basic for IPs. It's stuff that you guys already know. CAUTI risk reduction, consider alternatives to indwelling catheters when appropriate. Emphasize good hand hygiene, and that's a focus that we've been looking at for HEN 2.0, not necessarily, I know it's under the C-diff focus area, but hand hygiene affects infection prevention all across the hospital and in our care settings. Insert catheters using aseptic technique and sterile equipment. Use the smallest bore catheter possible. Generous amount of sterile lubricant for catheter insertion. Using portable devices to do your bladder scanning for patients with intermittent catheterization as an alternative to inserting indwelling Foley catheters. Proper system maintenance and securing the catheter appropriately to the leg using those stat-lock devices. Providing perineal care daily and after bowel movements. Observe and document the clarity of urine every shift, and review daily catheter necessity and remove as soon as possible. And that's where a lot of our discussion has been about using those indications for continued use and having nurses review that daily, as well as there are some hospitals that do it on a shift basis, by shift, to determine whether that catheter can be removed. Indications for insertion or removal, again, to relieve acute or chronic urinary retention, to obtain accurate measurements of urinary output in critically ill patients, there's been some question about this this area specifically, and I do just note that it's for critically ill patients, which is typically your patients in the intensive care unit, not just for patients that need an INO. There are alternatives to monitoring INO for patients that may be bedbound or cannot use the bedpan. For perioperative use in patients undergoing specific surgical procedures, promote healing of sacral or perineal wounds in incontinent patients, patients who require a prolonged immobilization, spinal and or epidural anesthesia, and to improve comfort for end-of-life care as needed. So those are all your indications for insertion or continued use. That bundle, that is what we call the CAUTI Bundle, and that is included on the IHC website with sample policies as well. And here is just a sample algorithm that includes those indications for continued use or indications for insertion if you would choose to use something like that within your organization. The bundle, elements of the bundle, we do also encourage implementation in the ED, avoiding placement of those catheters in the ED. That's very often where catheters are initially placed before a patient is admitted to the floor. And again, establish those clear guidelines for urinary catheter use or placement. Adopt those guidelines in the ED, engage your ED physicians and nurses, educate your staff, and enlist ED champions, physicians and nurses that can help drive that initiative within your organization. So here is our HEN CAUTI rate. This again is from NHSN. This is not self-reported data that we pull on a monthly basis. This is from baseline to current. And so you can see that consistent downline trend with our CAUTI rates. The end of 2015, the last half, we did see an additional downward trend. March 16 data is preliminary. I know we see that little spike up in there for March. When this was pulled the end of last month, there's a possibility that not all hospitals have their data in, so I'm hoping we see that continued trend downward. And then HEN catheter utilization is another goal for us for HEN 2.0. It's one of our focus areas. And again, we, especially the end of 2015 and the beginning of 2016, we saw that consistent downward trend. So we are seeing movement as far as overall CAUTIs and urinary catheter utilization. And this, we have had questions around this before. This does include all units. This is not just ICU, it includes all units. So ICU is included in this data. Any questions so far about anything related to CAUTI, or Nancy or Cheryl, do you have any comments or additions?
Hi, this is Nancy. The only thing that I was thinking is that often I hear that the IP is expected to be the champion for CAUTI prevention, and one of the things that, one of my biggest concern with that is the lack of involvement then or lack of ownership from nursing and medical staff. So I was just wondering if anybody had anything that they wanted to share with engaging a champion for CAUTI prevention. I know you guys are kind of a quiet group here, but I would encourage you as you are out and about, because we did talk on the slide, Jennifer has for the ED, to make sure that you have a champion in the ED for prevention of catheter insertion. But I think that maybe, especially if your facility has been seeing some CAUTIs, getting some leadership involved, nursing leadership or physician leadership, to take that champion role may be really helpful on that. So that was my only thought at this point.
Nancy, this is Joan and Regional Medical Center in Manchester, and I agree. Having a champion, for us, having the champion in the ED is a challenge. And so I think getting that person helps all your processes. So anyway, I agree with you.
Thanks. And it's not always easy to get that engagement, but I think it makes a big difference on the reception of the staff if they're hearing it from somebody who's at the bedside or somebody that's, in nursing on that area. I think it really does help them to understand the importance of that. So,
Nancy, this is Lisa Caffrey. And hi, what we're doing here at Genesis is I've been working with the nursing leadership and the president of the hospital, and we are assigning champions. And I know for nursing, what they're doing is that they're going to try to make it part of their professional development ladder, so that if you're a champion and a leader and you're at the unit level, that would count towards one of the projects that they could use for professional development. And we've had some success with that in our ICU, getting people to step up and take some ownership of it that way.
That's a really good idea. So great. It sounds like there are some opportunities to get, to build some of that into the nursing ladders, and I think that might be an opportunity if you haven't considered that, to talk to your leadership. So thanks for sharing that, Lisa.
I know some of the questions, since we're talking about best practices, and a lot of what to do, one of the things that I've heard come up at previous district meetings is obtaining urine cultures on patients on admission. And there are some hospitals that may still do that. There are several hospitals that no longer do that. Best practices. The CDC does not recommend cultures on admission. Does anybody have anything that they would like to share around that topic?
This is Sandy Sandell from Esterville, and we were about 4 years ago still collecting UAs on admission, and so to follow best practice, we did stop doing that, and just educated all the nurses and the doctors on what the recommendations from APIC and the CDC were. And they had a few questions about it, but as we talked it through, it really wasn't very hard to stop doing that.
Great, Sandy, thank you. Does anybody else have anything that they would like to share around the use of UAs on admission? Any stories? Does anybody still struggle with that? Or have they seen any success?
If that is something, this is Nancy again, I just wanted to mention that I know that sometimes it's really difficult to speak up on a call. If for some reason this is something that you're trying to work on at your facility, I do have the documentation from the Infectious Disease Society that talks about that, and also the Urologic Society that really addresses why that's not indicated. So if you need that to take to your leadership, just drop me an email and I'll send you those resources.
Okay, so we will move on to CLABSI risk reduction. Again, staff education for this, that's a huge piece. Appropriate hand hygiene, the use of full barrier precautions during insertion, avoiding the use of the femoral vein, creating a central line insertion cart. So all of your supplies are there, along with the implementation of a checklist for those for your bedside nurses. The use of chlorhexidine for skin prep, and just like with Foley catheters, asking your providers daily whether those central lines can be removed. And this is a big a culture thing, but empowering your nurses. I'm sorry, folks. Empowering your nurses to feel like they can stop procedures if the guidelines aren't adhered to, and that's a big step, but definitely relates to culture. The CLABSI Bundle, so this is another area where we've had lots of question about what constitutes the bundle. We talk a lot about bundle adherence for insertion and maintenance. So your insertion bundle consists of performing hand hygiene, adherence to the aseptic technique, using maximal sterile barrier precautions, using the chlorhexidine for skin antisepsis, choosing the optimal site for insertion, and covering the site with sterile gauze or sterile semi-permeable dressings. The maintenance bundle is, again, hand hygiene, scrubbing the access port or the hub prior to each use, something similar to like the Scrub the Hub initiative. Access catheters only with sterile devices, replacing dressings as necessary if they're soiled, wet, or dislodged, and performing dressing changes under the aseptic technique. CLABSI rates, again, this comes from NHSN. It is all units, not just ICU, and we have seen a trend upwards for our overall CLABSI rate. But central line utilization has trended down from the beginning of 2011 until now. Any questions around or comments, or anybody would like to share successes related to CLABSI? CLABSI rates, CLABSI utilization, reducing their rates within their organizations, or best practices you have implemented? Nancy, do you have anything that you would like to add for CLABSI?
No, I don't at this point. I think you covered it pretty well. And actually, we're seeing as we go out that people have things for CLABSI fairly well hardwired, but there again, if there's anything that you need, we'll be more than happy to help you with resources.
So next steps for us as a state with HEN 2.0, IDPH and Telogen, is really driving additional patient-family engagement, promotion of those transition triggers for catheter evaluation and removal. And when I talk transition triggers, I'm talking just from one unit to the next or from one side of care to the next. So how do we communicate the information that's necessary about the Foley catheters or the central lines from one setting to the next to promote those smooth care transitions? Encourage innovation and use of evidence-based practices, so we'll continue to encourage the use of those standardized policies and procedures. All three, IDPH, IHC, and Telogen, will continue to monitor hospital performance. We work with several hospitals, we work with all hospitals across the state, but several of them we have been contacting hospitals that are maybe in need of some additional assistance, or your rates may be higher than the state average. So we have been in contact with hospitals looking at opportunities for improvement, coaching and supporting as needed, and expanding to all care settings, which most hospitals have done. We're looking at all settings rather than just med-surg or just ICU, and looking at whole house. So any questions or comments about any of the CAUTI or CLABSI information that we've shared today? Okay. We'll go ahead and we'll move to updates. So your HEN 2.0 update, just like always, I just remind everybody of the HEN reporting deadlines. I know most of you do not report to the HEN 2.0 reporting database, but NHSN deadlines for that, for your NHSN information to be included on the monthly poll every month. I just ask that it's entered into NHSN 45 days from the end of every month. I know that that is different than the NHSN reporting deadlines. So on a month-to-month basis, especially for your SSI, those numbers may change. I update those every month, but for at least for your preliminary numbers, for those to be included in the HEN reporting database, and to have a monthly data point, I just ask that it's entered 45 days at the end of every month. Again, the NHSN data that we're looking at is CAUTI, CLABSI, C. diff, SSI, and VAE. In March, I believe I had sent out information to, or an email to everybody asking that you accept the new RICE template that I updated. That is just so I'm able to collect all your C. diff data. That was not originally included in our RICE template. So that is all that change does, is allow us to collect your C. diff data. Again, with the HEN Hub, I ask that everybody jump on the HEN Hub. Lots of great information on there, lots of great discussion. We do 2-week topic cycles. Right now we are working on a data topic cycle looking at run charts and how to use data effectively. The HEN Hub is a great place for you guys to hop on there and ask questions to the entire state about infection prevention or quality, best practices, or to share successes within your organization. So if you have questions or need the link to get on there, let me know and I will get that sent out. And then last week I sent out an email about regional meetings. We are going to be holding regional data meetings on the end of May, and there are the dates. Fairfield is May 18th, Storm Lake is May 19th, Waterloo is May 24th, Atlantic May 25th, and Des Moines is May 26th. A huge thank you to all the hospitals that have allowed us to hold these regional meetings within their organizations. Meetings for each day will be, registration will start at 8:30, the meeting will start at 9, and we will adjourn by noon, so they're just short. Jennifer Creekmer and myself will be providing a HEN 2.0 update, so looking at all of our focus areas, where we started and where we're at as far as meeting that 40-20, the 40% improvement in the HACs and the 20% improvement in readmissions. So giving you a quick update, and then William Peters will talk that last 2 hours or so about run charts, how to read them, how to use them to monitor your improvement, and to use that data to affect change within your facilities. So there'll be lots of information. The registration is on our website, so if you just go to our homepage, the data meetings are there, and you can click on that link and register for the site that is closest to you. There is no charge for the regional meetings, and we are offering a $50 travel stipend for each hospital that attends. So I encourage you to talk to your quality folks and attend if you're available. I think that's it for IHC. We'll move on to Nancy for the IDPH update.
Hi, everyone. I just wanted to, I know that when I kind of looked at the names of the attendees, that a lot of you were at the state meeting, so you are aware that there's some changes that are going on. And Lisa Caffrey, I'm not sure if you're still on or not, but I just wanted to, for those of you that weren't there, or if any of you had questions, just to kind of touch base a little bit on what's happening statewide with education. So Martha Freeman, this was her last year in helping to organize the state IP meeting. So we are going to need to consider, and there's been other changes at the University of Iowa, which is going to really necessitate some other players stepping up to help facilitate that meeting so it goes on, because it's been very obvious to me over the years that that meeting is very important to the IPs around the state. So we have at the, by the end of that meeting, we have identified some players that are going to help with that. Lisa is one of those that have offered to participate in that. The University of Iowa has offered to maintain a level of involvement, and then IDPH will also play a key role in that. It's really still a work in progress. We have a call set up this week to kind of figure out how all this is going to come together. We really want very much to be able to continue that annual meeting, and because I just think it's such a good resource for you guys. So as soon as we get some more of the details worked out, we will definitely be keeping you guys informed of that. So look forward to a meeting again next year in May. The other thing is that I know that there was a lot of people out there that were looking forward to taking the extension training program this fall, and that is another thing that is not going to be offered in its regular format through the University of Iowa. The future of that is still just kind of up in the air yet. I don't know if that's something that maybe will still be offered every other year, but in the meantime, we have started to talk a little bit on how we can get some training for those of you that are new IPs, so that you at least have a little bit of direction on which way to go. And also, I mean, the bottom line is you want to be able to say if a surveyor walks in your facility that you've had training. So we are looking at putting together an intensive type, maybe a 2-day program that we'll be able to offer. I don't know the timing of that yet. We would like to be able to do it this fall, the same as or similar to what the extension training would be. And I'm assuming that we'll probably do that in central Iowa, somewhere in the Des Moines area. I'm looking into locations, and that's going to depend on registration, so how many people I need to accommodate with that. So if you are interested in getting some additional training, we're going to be utilizing some of the experts in the APIC chapters, so we're going to pull together a good group of people to help with the presentation on that and try to keep cost to a minimal on that. And the other thing I wanted to let you know is, and I know that a lot of you heard this already, but one of the things that we've identified through our hospital visits is that there again, with all the new employees, the new IPs that are out there, there's really just not a good thing for people that are walking in for those first couple of months that you're in the job. What do you need to know? At IDPH, we're working on a packet that we'll be able to get out. We would like to be able to bring it out to you, but in the meantime, we'll at least be able to send that out to you electronically. So that's a work in progress. I don't have that finalized yet, but I wanted to let you know that that is something that we hope to be able to share with you guys, especially those of you that are new in the near future. So as far as anything else going on, there was a webinar notice that went out for Zika that's on the 12th, and so if you're getting questions on Zika, that you might want to register for that presentation. And we're still busy with Zika and mumps here at IDPH, so it's keeping us busy. So that's about all I had to say, unless anybody has questions.
Nancy, this is Lisa. Yeah, I couldn't log in, so I'm just on the phone. But you did a really nice job of summarizing everything. I think it's just important that we go into all this with an open mind. It's an opportunity to maybe make some changes. It's been like this for a long time, so I'm looking forward to making changes for the state meeting and whatever we do with education. I think this is just a great opportunity to look at things a little bit differently. So there will be more to come, as Nancy said.
I agree. I think this is it's an opportunity for all of us to take a more active role. So we did ask for those of you that were at the state meeting to get us ideas on subjects and also speakers for the meeting next spring. So if you didn't get a chance to give us any feedback on that, we have not received all of the evaluations yet and the comments on that, so I know we'll get some of those. Zip one of us an email, so either Lisa or myself, so that we can make sure that we're covering topics that's going to be of interest to you guys. So we really want this to be the state IP meeting, so something that's going to be yours that we can really help you address your needs in your facilities. So I think it's going to be a lot of changes and it's a little bit of it's going to be a lot of work involved, but I think it's going to come out and be very positive in the end. So thanks, Lisa.
You're welcome. Thank you.
Any other comments or questions for Nancy?
Hi, this is Maggie Busta from Winneshiek Medical Center in Decorah, and I just wanted to say thank you for all of these efforts in trying to get the information out to those of us that are new to the position. I was able to attend my first state conference last week, and it was fantastic. I wish I could just remember every single detail that was there, because it was just fabulous, all of it. And I look forward to the intense training whenever it is, wherever it is. So thanks.
Well, thank you, Maggie. And we try to pick out one of the new people for that drawing. So obviously you walked out of there with a little wealth in your pocket, so that was always a positive too. Glad you were able to attend.
Absolutely fantastic.
Okay, we will move on to the Telogen update. Cheryl, are you on the line?
I am. Thank you, Jennifer. So I sent this slide to Jennifer, just a graphic that shows you something that how hospitals and nursing homes share patients and share infections, and so this just to illustrate something that CMS has asked us to begin working with in Iowa on, and that's C. diff reporting for nursing homes. There's going to be a call tomorrow. If you get the Telogen bulletin, it was in that. It's called C. diff reporting and prevention in Iowa. It's about a 15 to 20-minute call where Dr. Mulhausen, Nancy Wild, and Kate LaFollette will just be introducing an opportunity for communities, hospitals, and nursing homes to work together in C. diff reporting. So if you all just have a few minutes to listen to that, go to the bulletin, you'll find it. If not, you can go to our TelogenQuinQIO.com website. Just scroll to the bottom, it has our events. So you'll be learning more about that from your nursing homes. So, and I guess that's really all I wanted to talk about was tomorrow's call, and I'd be interested in hearing from any of you that know of C. diff in your communities, and just reach out to me if you want to talk about it at length. I'd be happy to talk to you. Thanks, Jennifer.
Thanks, Cheryl. Any questions or comments for Cheryl? Okay, I'm going to open up the call to any other questions or comments. Doesn't necessarily need to be about CAUTI or CLABSI. Any questions that you may have for Nancy, Cheryl, or myself, or for anybody else in the group?
This is Marilyn from Catheter Health, and I don't have a question about the CLAUTI or CLABSI, but I know we talked about MediQuip being reporting into the HEN, but the MediQuip that's being reported into CART, would we be able to discuss that here, or is that another call? You can email me or give me a call, and we can talk about MediQuip offline if you have additional questions about it. Okay. All right. We'll do that.
I do have a question that just popped up on chat saying, in preparation for the state meeting in the future, would there be a possibility to address critical access hospitals specifically? Nancy, I'll hand that one off to you.
I think that's a very good possibility. I'm not sure how that'll all come together, but I will tell you that on a national level, there's a real push for being able to meet the needs of the critical access around. So if you have any specific topics that you're interested in, let us know. As I was looking around the room, there was a lot of critical access and a lot of other facilities other than the big hospitals that were represented at that meeting. So we are really looking at how can we be inclusive and include critical access, ambulatory surgery, some of the long-term care that were there and all of that. So we would love to be able to have a visit with you about what's going to be helpful for you. But yes, the long answer to that is yes.
Any other questions or comments? All right. Our next call will be on June 13th at 11 o'clock. The HEN Learning Community will be on June 14th. Registration for that will be up on, I think will be available tomorrow, or early this week. The registration will be available on our website. Care Coordination Conference is on June 15th. And again, our regional data meetings, May 18th, 19th, 24th, 25th, and 26th. And registration for those are up on the website. If there are no other questions or comments, we'll go ahead and we'll end the call. Thank you, everybody, for joining us today. Our next call on the 13th, we'll be talking about surgical site infections. And so we'll talk to you all then. Have a great day. Thank you.